Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a medication that we covered in the past, known as duloxetine or Cymbalta. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing we'll discuss in this presentation is what this medication is used for. So duloxetine treats a couple things, being depression, anxiety, diabetic peripheral neuropathy, fibromyalgia, and chronic muscle or bone pain. Now, how to use this medication. So first, take your medicine as directed. Your dose may need to change several times to find what works best for you. If you're using the delayed release capsules, swallow the capsule whole. Do not crush, chew, break, or open it. Do not open the capsule and sprinkle the food onto food or liquids. There are some capsules where you can do this, but if you're using the delayed release duloxetine capsule, do not open the capsule. What happens if you miss a dose? So take a dose as soon as you remember, but if it is almost time for your next dose, wait until then and take a regular dose. Do not take extra medicine to make up for a missed dose. This medicine should come with a medication guide, so be sure to ask your pharmacist for one if you did not receive one when you were picking up your prescription. We'll now go over some warnings for duloxetine. So tell your doctor if you are pregnant or breastfeeding, or if you have kidney disease, liver problems, bleeding problems, glaucoma, diabetes, digestion problems, heart disease, high or low blood pressure, or problems with urination. Also, tell your doctor if you smoke or if you have a history of seizures, mental health problems, including bipolar disorder or mania, or drug or alcohol addiction. This medication may cause the following problems. So serious liver problems, serotonin syndrome when it's used with certain medications that also affect serotonin, increased risk of bleeding problems, serious skin reactions, low sodium levels in the blood, or sexual problems. This medication may increase thoughts of suicide, so tell your doctor right away if you start to feel depressed, or I should say if your depression worsens, if you're using it for depression, and have thoughts about hurting yourself. Duloxetine may cause blurred vision, dizziness, drowsiness, or trouble with thinking or trouble with controlling body movements, which may lead to falls and fractures or other injuries. So do not drive or do anything dangerous until you know how the medication makes you feel. Do not stop using this medicine suddenly. Your doctor can work with you to decrease the dose slowly. Over the next couple slides, we'll go over side effects or adverse events. For the first two slides, just keep in mind that if you experience any of these side effects, you would want to call your doctor right away or go see your physician. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, if you had blistering, peeling, or red skin rash, anxiety, restlessness, fever, fast heartbeat, sweating, muscle spasm, diarrhea, seeing or hearing things that aren't there. If you have a combination of these side effects, that could indicate that you're experiencing serotonin syndrome. If you have confusion, weakness, or muscle twitching, you would want to get in touch with a physician right away if you have dark urine or pale stools, nausea, vomiting, loss of appetite, pain in the stomach, yellow skin or eyes, a decrease in how often or how much or how often you urinate, a decrease in sexual ability, desire, drive, or performance, eye pain, vision changes, or seeing halos around lights, feeling more energetic than usual. This could be a sign that you're experiencing hypomania or mania, or worsening of depression. Now for these side effects, you would just want to discuss them with your physician at your next appointment, or even with your pharmacist next time you pick up a prescription. So if you have decreased in appetite or weight, dry mouth, constipation, or mild nausea, a headache, or unusual drowsiness, sleepiness, or tiredness. Alright everybody, that's all we're going to talk about today with duloxetine or Cymbalta. As always, I'm very thankful you took the time to go by and watch my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today. Take care.